This is Beth Bartleson reporting on advances in integrative nanomedicine for improving infectious disease treatment in the public health setting. The purpose is to briefly introduce research on nanoparticles, NPs, and nanomedicine and their implications for safe and effective treatments of infectious diseases using conventional medicine, botanicals, nutraceuticals, and homeopathics. A PubMed search of articles in English with a word search including nanoparticles, nanotechnology, and nanomedicine was used. The authors focused their search on papers published within the last 5 years, including peer-reviewed research articles and other reviews. A set of 79 papers comprised the information necessary to develop the white paper. Nanoparticles are some of the very smallest forms of material substances, and they measure from 1 to 100 nanometers in diameter along at least one dimension. They can form from physical, chemical, or biological methods and occur naturally and synthetically in the world. Nanotechnology is an engineering term for the manipulation of nanomaterials at the atomic and molecular level. Nanomedicine is the utilization of nanotechnology to improve the field of healthcare. Many nanoparticles have implications for diagnosis and treatment, but many can cause toxic effects such as adverse cardiopulmonary effects, with smaller NPs being more toxic than larger NPs even when from the same source material. Toxic NPs are being studied as an etiological agent for autoimmune diseases, neurodegenerative disorders, and Crohn's disease. Some studies have shown that certain NPs can produce apoptosis effects on specific breast, lung, liver, or brain cancer cells, but not on the healthy cells. Other studies provide evidence of NPs activating anti-inflammatory, antioxidant, and immunostimulatory effects. NPs readily cross cell membranes, even the blood-brain barrier, which makes a very positive tool for treatment delivery. One example of this would be the transmission of antiretroviral drugs in HIV and AIDS. With infectious diseases continuing to present public health challenges and with the limitations of conventional treatment such as with antibiotics, the literature provides evidence in support of traditional herbs and homeopathic remedies to treat individuals with acute and chronic infectious and inflammatory diseases. These homeopathic remedies could possibly be one of the safest forms of NP-based treatment for infectious diseases and can act as an agent that increases the body's ability to adapt to change without having to rely on receptor targets. Data in the literature suggests that homeopathic medicines may be low doses of mineral, plant, and/or animal-sourced nanoparticles. One large public health intervention with prophylactic homeopathically prepared oral doses of an inactivated bacterium, leptospirosis, in over 2 million people in Cuba significantly reduced disease incidence compared to a non-intervention during a high-risk rainy season. Modern nanoparticle formulations can lower drug, vaccine, herb, and nutraceutical dosing and release active agents only once inside target cells, which can lower drug-to-drug interactions, side effects to improve outcomes and safety, as well as lowering treatment cost. Another advantage is risk reduction of drug-resistant organisms in the general population, with the need of further research to focus on defining best practices for the manufacturing, distribution, and administration of nanoparticles-based integrative treatments using more natural products for infectious disease.